The intense debate in Congress over whether to keep the COVID-era tax credits that reduce Affordable Care Act, ACA premiums, could soon lead to thousands of Long Islanders facing much higher health insurance costs. This issue is poised to become a major showdown as lawmakers decide whether to include these subsidies in a funding bill designed to keep government agencies operational beyond the September 30th deadline. Many ordinary Democrats, frustrated by what they see as their leaders' previous hesitations in challenging Republicans and former President Donald Trump, are gearing up for a stern fight to prolong the subsidies. They want these tax credits renewed as part of the government funding process, recognizing the critical impact these aid programs have on Americans' ability to afford health insurance. However, influential Republicans and conservative lawmakers who hold the reins of both the House and the Senate are determined that these enhanced tax credits end as scheduled on December 31st. They refuse to allow any language in either temporary funding bills or longer-term appropriations that would extend the subsidies, even if the result means shutting down parts of the federal government starting October 1st. Supporters of ending the credits argue that continuing them would deepen the federal deficit substantially. Budget analysts in Congress estimate that maintaining these tax breaks could add around $40 billion to the deficit annually, potentially surpassing $300 billion by 2034, an enormous amount taxpayers would have to cover. These tax credits were initially a temporary safety net during the pandemic, says House Budget Committee Chairman Jody Arrington, R. Texas. They were never designed to be permanent fixtures. On the other side, New York's junior Senator Kirsten Gillibrand, who leads the Democratic Senatorial Campaign Committee, is championing the cause for extension. She is urging lawmakers to include the ACA premium tax credits in any government funding legislation passing this fall. These subsidies are literally saving lives, she stresses, and I am committed to keeping them available. Interestingly, while Gillibrand stopped short of advocating a government shutdown to force the issue, Senate Majority Leader Chuck Schumer, also from New York, has signaled a willingness to risk such a shutdown if necessary. Schumer, along with House Minority Leader Hakeem Jeffries, both warned that Republicans must come to the negotiating table for significant health care policy compromises. Otherwise, they will withhold support on related legislation. Schumer bluntly stated at a news conference, "If Republicans don't work with us on healthcare solutions, they won't get our votes, plain and simple." The looming deadline for the must-pass federal budget bill will be a critical test of these warnings. Even a short-term stopgap measure requires some Senate Democrats' votes to pass. So the stakes couldn't be higher for people who rely on ACA coverage, also known as Obamacare. Historically, the ACA has offered subsidies based on income to help make health insurance affordable. But during the pandemic, particularly in 2021 and 2022, these subsidies were significantly expanded. For instance, previous income limits were lifted, and the credits were extended to cover more people earning higher incomes than before. Letting these provisions expire at the end of this year, analysts warn, would threaten coverage for approximately 4.2 million Americans. In New York alone, about 1.6 million people enrolled in the Essential Plan and 140,000 in qualified health plans currently benefit from these enhanced subsidies. Without them, their premiums would soar, increasing on average by 38% statewide. This means individuals could see monthly premium hikes of about $114, while couples might face rises of up to $228, amounts that could push coverage out of reach for countless families. The numbers are stark on Long Island as well. There are roughly 117,200 Nassau County enrollees and 133,500 Suffolk County residents receiving these premium tax credits. If the subsidies end, their average monthly insurance costs would jump by about 32%, equating to an extra $115 for individuals and $219 for couples, a massive financial strain. In terms of legislative strategy, Senator Schumer recently sent a letter to major health insurers, urging them to alert policyholders about the possibility of losing these credits. This move aims to build public pressure on Republicans to agree to an extension. However, Schumer has not yet revealed exactly how Democrats will handle the political battle ahead, especially since GOP resistance remains strong even for a short-term one-year extension. Republican Senate Majority Whip John Thune, RAR, South Dakota, publicly rejected including any extension language in the imminent government funding bill, preferring it to be clean to avoid complications. He did leave open the possibility of discussing it later in the fall during negotiations over the broader budget. Meanwhile, House Speaker Mike Johnson, RAR, Louisiana, dismissed concerns that Democrats might purposely trigger a government shutdown over this or other disputes. He criticized Democrats for lacking clear leadership or a unifying message, pointing out their low approval ratings and making a pointed remark about New York City's political landscape. Nevertheless, within the Republican ranks, some signs indicate a softening stance on this issue. Long Island's two GOP House members, Andrew Garbarino and Nick LaLota, acknowledge ongoing discussions about potential solutions to preserve health insurance coverage and prevent people from losing vital subsidies. Additionally, 11 moderate House Republicans, many facing tough re-election battles next year, have backed a bipartisan bill co-sponsored by Democrat Tom Suozzi of Long Island to extend these tax credits for an additional year. Political analysts warn that if the subsidies expire amid previous GOP healthcare setbacks this year, some Republican lawmakers could face voter backlash. Suozzi, who serves on the influential Ways and Means Committee overseeing tax policy, stresses that resolving this issue falls squarely on the party controlling both Congress and the White House. He underscores the urgency, saying, "We cannot let people confront thousands of dollars in premium hikes just because these critical tax credits disappear." But here's where it gets controversial. Is it fiscally responsible to add hundreds of billions to the deficit to keep these subsidies going? Or is protecting millions from losing essential health coverage worth the cost? And should Democrats risk a government shutdown on this issue or pursue other political strategies? These questions are far from settled and will certainly ignite spirited debate in the weeks ahead. What do you think? Should the enhanced ACA premium tax credits be extended despite the budget impact? Or is it time to let them expire and focus on alternative healthcare solutions? Feel free to share your thoughts and engage in the discussion.